Morning. We're glad to have all of you here today and glad to have a little bit of good news that we can share with people. We're very happy to be able to share with you that this week, in fact, we are kicking off a number of national clinical treatment trials for COVID-19. We have been working on this for probably about a month or so, and we're really excited that we have gotten to this point. We, in fact, enrolled our first patient yesterday. You'll hear from Dr. Summers about the range and the breadth and the scope of these trials. We're very pleased that there is a large range of these options for trials for the patients of Mississippi, for the citizens of Mississippi. We are glad as the academic medical center in the state to bring this level of expertise to our people here in Mississippi. It is important to emphasize that there is no currently approved, commonly accepted treatment for COVID-19. But the way that you get to that point where people understand what the treatment options are and what medications and what interventions actually work is through the process that you'll hear described a little bit more this morning, and that's through the clinical trials process. So this is important for the country, it's important for our state, and mostly it's important for the patients to have that understanding of what actually would be valid and important and helpful treatment modalities. I also want to say, you'll see outside the building here, we have outfitted a special transport vehicle for these patients if needed, just to help in the transport and the safe transport of patients that are COVID-19 positive. At this time, I'll turn it over to Dr. Richard Summers.
Thank you, Dr. Woodward, and thank you, everybody, for being here. As the state's only academic healthcare center, our physicians and research scientists routinely conduct clinical trials to determine the effectiveness of new therapies for diseases with no known cures. As recently noted in the Journal of the American Medical Association, there's a consensus of experts that medical treatments for this new coronavirus threat, COVID-19, should be conducted within the context of clinical trials with approvals by the FDA and with human research protections. The clinical trials that UMMC physician scientists are opening cover the full spectrum of currently available medical treatment options and will include everything from therapies for patients in the intensive care unit, and will also have patients that are early in their course of their infection. It will also include both adult and pediatric patients. Just as we did in assisting with off-site sample collection, developing of our own in-house testing capabilities, we want these treatment trials to serve as a resource for the healthcare services of the entire state of Mississippi. And now I would like to introduce you to some of the principal investigators in these clinical trials, Dr. Galen Marshall and Dr. Alan Jones, to talk about their clinical trials in more depth. Thank you.
Sure. My name is Alan Jones. I'm the chairman of emergency medicine. One of the trials that I am leading is an NIH-sponsored trial. It's a trial of a drug that we've all heard a lot about on the news called hydroxychloroquine. Hydroxychloroquine's been in existence for a long time. It's an anti-malarial drug. It modulates the immune system. And there were some early reports that it may have some good effects on patients with COVID-19. Recently, there have been several reports that have suggested that maybe it does not, and perhaps even it's detrimental. We do know that there are some side effects associated with it. The trial that I'm leading is a randomized trial of hydroxychloroquine versus standard of care, and that's instituted early in the course of COVID-19 at the time of admission to the hospital. And the goal is to determine if it prevents death and respiratory failure from patients who have COVID-19 if it's instituted earlier in their course. We're pleased to be able to offer this as a potential treatment option for the citizens of the state of Mississippi, and we welcome any institution that thinks they may have patients that would qualify for this to let us know, and we'd be happy to get them enrolled in the study.
Good morning. My name is Galen Marshall. I am the medical director for the Clinical Research and Trials Unit here at UMMC and the executive director of the Mississippi Clinical Research and Trials Center. We have several trials that are standing up that will be of use to patients, particularly those with more severe disease. But let me take 30 seconds to help explain to you a little bit about how these trials are approached in terms of the underlying causes. So this coronavirus that is particularly difficult for us right now does two things. Number one, it infects us, obviously, and then our body trying to respond to it can sometimes overreact. And you'll hear the term cytokine storm used a lot, and this is particularly true in people that have more severe disease because that storm is almost like the lungs exploding. And it creates this SARS that people are talking about that can be fatal in these patients. So the clinical trials that we and others are doing are aimed at one of the two things, to either try to take the virus out of the equation or to try to mitigate or stop the effect of this cytokine storm on patients. So let me just tell you about three trials that we have going on. One of them, the principal investigator is my colleague, Dr. Jason Parham, who's chief of adult infectious disease here at UMC. This is with a antiviral drug called remdesivir. And this is a use trial that UMC just recently had placed with us, and we think will be very useful in the direct antiviral effects of this drug on the coronavirus itself. Two that I am privileged to lead. One of them is trying to treat this cytokine storm in severely ill, even life-threatening corona disease, and that is a monoclonal antibody that's directed against one of the components of this cytokine storm. It happens to be called GM-CSF. But the goal will be to identify these patients as early as we can as they're enrolled in the study to see if this drug may have an impact on them compared to standard of care alone. And the third one, which also I think that you've heard some about in the media, a lot of interest nationally that we're standing up here on this campus as well, is that as individuals recover from the virus and they get well and they go back to their lives, their bodies have made varying numbers of antibodies against the virus itself. In-house, we have developed the ability to look at the quantity of these antibodies, and in one in particular called a neutralizing antibody because it neutralizes the effect of the virus. And now we are engaging volunteers from the community who have recovered and would like to be involved as potential donors of plasma. Once that plasma is characterized and put up, then a severe COVID patient who has a need for that may be eligible, and therefore they can have a unit of that plasma transfused back. In some other studies, there have been some dramatic improvements, and it's like in all these we expect a spectrum of improvement, but we now have multiple tools to address the moderate to very severe COVID patients that we expect to see.
Okay, open the questions.
Are these currently underway? How does it work? How long will this take? What's your name, sir?
Dr. Richard Summers, Associate Vice Chancellor for Research. And yes, we have started the trials. We began yesterday. We're expecting to stand up a couple more this week and more over the next couple weeks. We have in the queue right now about 10 trials altogether. Again, the full spectrum of treatments from early stages on through the intensive care unit, both adult and pediatric.
What will be the results of this, of all your trials? The FDA say UMMC has come up with cures or whatnot.
So most of these trials were in partnership with other institutions around the country, with the FDA, with NIH and others to conduct these trials. One, it provides treatment options for these patients. Well, currently, there are no standard of care treatment options for them. Also, it will provide us some understanding for future, what are the good methodologies and treatments for these patients and we'll learn from this as we go forward.
Are we entering this new stage because we've met our peak and we're seeing a downfall in cases, so we're able to open up medicine a little bit?
Well, it is advantageous that we're coming onto these trials right at the time that we're starting to see a surge across the country, as a matter of fact, but it takes us several weeks to get all the things in place to conduct such a clinical trial with the FDA approvals and the human research protections that are necessary to do this.
What patients will qualify for this?
Well, those that test positive for COVID-19 are the primary ones that we're looking at.
Of those patients, are there specific subgroups that y'all are looking at specifically?
No, we're looking at the whole spectrum, from early on treatment to those that are critically ill on a ventilator. In fact, about half of our trials are on critically ill patients that are on the ventilator.
How many people are in this study?
We initiated the first trial yesterday, enrolled the first one yesterday afternoon. We'll be continuing this week and ramping up through the next couple of weeks with all of these 8 to 10 trials.
Okay, any other questions? Okay, real quick while we have you here, we actually have another announcement to make today, and this one is of particular interest to local Mississippians. So Alan Jones is going to come up and tell you about that.
Last week, we met with the press to introduce our respiratory clinic that was opening in the lower level of our garage on the south side of campus. Today, we have opened that clinic up to the general public. So anyone in the general public that wants to access the respiratory clinic would do that through a telephone number. I think we're going to release that number here in a little while, and they would have a telehealth visit with a provider and then be scheduled to come in for an appointment at the respiratory clinic. And that's both pediatrics and adult patients.
Can you real quickly, just briefly, tell us again what that clinic, the patient population that clinic serves?
So it is all ages, that the population that's served is all ages. For the pediatric side, we really are working with the community physicians so that their pediatrician is referring them to that area. That area is specifically designated for patients with respiratory disease. We have the ability to do some specific testing, x-rays, things that we would need to evaluate a patient with respiratory disease. And that runs through the spectrum of no higher end of the age. But the real intent of it is to only evaluate patients with respiratory disease that may be concerned that they have COVID-19.
Will y'all be expanding that to other locations in the future?
Presently, we don't have any plans to expand it, but if we saw an increased need or demand for those services that we weren't able to fulfill there, we certainly would be willing to do that. And we're working on that clinic kind of on a daily basis on the processes. So there even would be the opportunity to expand it further within the confines of where it sits now.
And do you know how many patients y'all have seen in that clinic so far?
I believe we opened on Friday and saw maybe 12 to 15 patients, about the same, probably more than that yesterday. But we have the opportunity to see at least 25 adult patients and about the same number of pediatrics patients today. All right, thank you.
Any other questions? All right, we will we'll be sending out a press release about the clinical trials announcement, and in addition, what Alan was just speaking about, we'll send out a release about that also later today to get that information out, especially for those patients that need respiratory care but don't need to go to emergency department. So, any other questions? Any other? All righty. Thank you for coming today, y'all.
All right, what you were just watching was an announcement from the University of Mississippi Medical Center about the new clinical trials that they have started there at the hospital. Of course, UMMC is Mississippi's teaching hospital, so they're always on the cusp of very innovative things there at the hospital. So now they're working on some clinical trials to help the people who are suffering from coronavirus to learn more about coronavirus, from those who have never been diagnosed to those who've been diagnosed and have been cured, and also working with those who currently have that virus. And speaking of coronavirus, the Health Department just posted their updated numbers for today. 273 new COVID-19 cases in Mississippi are being reported. There are also 11 more deaths. This makes more than 3,300 patients who've been diagnosed in Mississippi and 122 total deaths. Now, don't forget to watch 16 WAPT for the daily update from Governor Tate Reeves. It's coming up at 2.